Hey, everybody, welcome back to Beyond Hormones, the business of wellness. I'm your host, Jody, and today we're doing another Thursday Fiver. It's your weekly dose of real actionable strategy that you can take back to your clinic this week and make an impact. All right, what's today's topic? It's follow up. Now, I know it sounds like something you're already doing, and you may be inclined to turn off the podcast, but don't, because I want you to first ask yourself this question. Are you doing follow up really well? Or is your clinic like most clinics out there where you put all of your attention and energy into the first appointment and then kind of expect the patient to just keep showing up because they got great results? Well, if it's the latter, I want you to hear the hard truth that I have to share. What happens between appointments matters just as much as what happens when the patient is in the room with you, the provider. You see, patients are judging your clinic, not just on the care you give or the results they get. They're judging it on how supported they feel when they're not standing in front of you. And most clinics have a huge gap there. I mean, huge. So today we're going to talk about a very simple, easy to implement framework that closes that gap. I'm calling it the 3-bucket follow-up framework because we're going to talk about 3 areas: clinical, operational, and marketing. And when you layer all 3 together, you stop losing patients to being silent. All right, let's start with clinical follow-ups. Now, quick note, this is not about what's medically necessary. That is not my job. That is between you, the provider, and the patient. This is about the patient experience of their care. And in that first year, the first year is everything. Year 1 is where you build trust. You build rapport. Patients who feel supported in year 1 are the ones that stay for years 2, 3, 4, 10. So what does that look like? Well, ideally, you want to get patients back in the office fairly quickly after that first appointment. Think 5 to 7 weeks, and then roughly every 3 months throughout that first year. You see, that cadence keeps patients from drifting, gives you time to check in, ask how they're doing, follow up on their treatment. Is it really landing? And lets you make adjustments before problems turn into reasons they leave or they go off treatment altogether. Now, here's something a lot of clinics tend to skip. It's a 1-year anniversary appointment. Now, this should be longer than a normal visit. You want to take the time to revisit the entire year, celebrate the wins with the patient, and reset new goals for the next year. Patients who feel genuinely invested in are going to stick around, and that single touch point can do a lot of heavy lifting for retention. Now, here's another small little tip that can make a huge difference in your office. A check-in call 1 week after the initial appointment, not from you, the provider. This can be your front desk. It can be your medical assistant. Your patient liaison is the perfect person for this. The purpose is just to confirm they got their medications, they know how to use them, they're not spiraling into asking Google or ChatGPT questions because they're not asking you. That silence, if it exists in the first few weeks, that is when patients begin to second guess everything they're doing. And you want to be the voice that gets there first before they go to their computer to ask. Now, one more coaching moment on this. Train your team to stop ending calls with, "Call us if anything comes up." That puts the burden on the patient, and most patients are not going to call your office and be a bother. Instead, end it with something more like, "I'm going to check back with you next week and see how you're doing." See, that's a proactive action. That's proactive callback. And that simple 2-minute phone call could save a patient relationship. All right, bucket 2 is operational follow-ups. Now, these aren't medical, they're just communication. And they're about making your patients feel like your systems are working for them and not against them. Of course, appointment reminders are basic, but you want to make sure that you do them so well that you reduce no-shows. In-person appointments, send out several, 1 week out, couple of days before, and the day before. For virtual, go ahead and add a 15-minute reminder right before they're supposed to log in so they have the link right there for them. That last nudge, it really does matter more than you probably think. And your patient portal, don't let it become a black hole. Nothing erodes trust faster than a patient sending a message and hearing nothing back. Even if, and actually this is a great idea, go ahead and add an auto reply that says, we got your message and we'll respond within the next 48 hours. That changes how the patients feel while they're waiting. They're not wondering if you saw it because they know that you did. And here's a move I love. Send a quick portal message when labs come in and they're under review. That removes the anxiety about what's coming completely. See, your patients know when labs are back because they're probably getting notified by Quest or LabCorp. They want to know that someone's looking at it. And when they know that, they'll stop worrying. Think about it like tracking an Amazon package. People are genuinely not stressed about buying things from Amazon because they can go into the app and they can see exactly where it is in the delivery process. Give your patients that same visibility. Now, a key point here, whatever response time you tell your patients, make your internal standard tighter. If you tell your patients 48 hours, then your team's target should be 24. You'll consistently beat expectations. And that's the kind of thing that patients love and will tell their friends about. Okay, bucket number 3. And we're going to talk about marketing follow-up. And you may be thinking to yourself, Jody, why do I need to market to patients who are already mine? I spent the money to get them. Well, because keeping a patient costs a fraction of what it costs to get a new one. You see, most hormone and functional medicine clinics are spending anywhere from $150 to $600 to acquire a new patient, sometimes more when you're just starting out. But retention? We're talking $20 to $50 a year when you're using smart automation. The math is embarrassingly in favor of retention. So what does patient retention automation look like? First, something simple like birthday messages. How about anniversary messages when they reach a year, 2 years of their treatment? Congratulations on your first year, little post-it notes. These are easy to automate and they make patients feel seen. You can even use these moments to introduce an add-on service or give them a gift. Don't sell them something. You want to give them a gift. There is a difference and patients can feel the difference. Now, then there's educational content, and this is my favorite and probably the most underused piece in most clinics. Patients walk out of their first appointment with a ton of information and they forget most of it by the end of the first week. So a first year automation sequence, a series of 8, 14, even 24 emails spaced across that first year keeps them educated, keeps them engaged, and honestly helps them feel more confident in their choice to start treatment. You could even weave in some milestones. Maybe at week 4, you talk about what they should expect to be feeling. At week 6, remind them why blood work matters so much because that's usually when you're getting their first blood work. And at 6 months, just do a check-in. And just before their anniversary, give them a little heads up. Each one of these is a touch point that says, we're thinking about you even when you're not in the office. And you want a bonus move? The content you create for your patient education emails can be repurposed. Use them as blog content. Create social posts around them. It will help you attract brand new patients. One piece of content doing double duty. Just like we talked about on last week's Fiverr, if you haven't listened, I would go back and listen to that because it talks about how you can create 4 pieces of content per week and turn them into a month's worth of content. So here's your takeaway. Follow-up is not an extra task you add to an already full plate. Follow-up is the patient experience. And the clinics that figure that out are the ones that don't have to hustle as hard for new patients because their current patients, they stay, they refer, and they review and rave all about you. Start small. Pick one thing from each bucket. Try it. Test it. Get your team used to it. Then add another layer. You don't have to build everything I'm talking about overnight, but you do have to build it if you want to create an extraordinary patient experience. Now, if you want the full framework, the templates, the automation ideas, the whole thing, we go deep into this inside the accelerator. Go ahead and check it out at accelerator.acceleratedmedicalpractices.com. You can sign up for a free account, take advantage of the free courses that are in there. And if you see something that you want to purchase, you can buy them individually, or you can do what a lot of clinic owners do, which is sign up for the $99 Power Pass and have access to all the content. I hope that you really got a lot of great golden nuggets that you can take from today's podcast and go put them into your clinic. And trust me, while these things may seem simple, they may seem like they're not that important, they make small shifts in your patient experience that compounded over time are going to have people raving about your clinic, patients staying for years, and lowering your ultimate marketing budget because you don't need to keep adding new patients to replace the ones that you've lost. All right, guys, thank you so much for being with me here today. I appreciate your time. If you heard something that you thought would be helpful to another practitioner, do me a favor, share this episode with them. I appreciate your time.